Up to 9 out of 10 sore throat infections cannot be treated with antibiotics. I'm going to teach you how to treat a sore throat at home. It's a chilly one today. So sore throats are very common, and they're usually nothing to worry about. They normally get better by themselves within a week. But 1.2 million people still visit their GP every year in the UK for a sore throat. 1.2 million people. And sore throats are the largest contributor of inappropriate antibiotic prescribing in England, and it amounts to nearly 23%. Normally, I don't like to be the healthcare professional who's all doom and gloom, but the reality is this. Inappropriate antibiotic prescribing is contributing to a rapid increase in antibiotic resistance, which is a massive global threat for everyone. So I really do hope my tips help you today, but if you need further expert advice on your sore throat, then pharmacists should always be your first port of call. Now let's get to it. For sore throats, the first thing I advise nearly all my patients to do is to gargle warm salty water, because it's actually really effective, it's relatively inexpensive, and almost everyone, well most people, can do it at home. Gargling warm salty water can help soothe the throat and reduce inflammation. So to make your solution, all you need is half a teaspoon of salt, a mug, and then dissolve it in some boiled water. Once you've dissolved it, let it cool, and then gargle it. Make sure you don't swallow it, and it's also not suitable for children. Tip 2. Drink enough fluids to avoid dehydration. I know it's tempting when you're not well and it's painful to swallow to maybe drink less water, but when you're not feeling well and let's say you have a temperature, you're at higher risk of dehydration. Becoming dehydrated can make headaches and tiredness worse and can even lengthen recovery time. So, you need to aim for 6 to 8 glasses a day and avoid hot drinks. Hot drinks can actually make sore throats worse. Tip 3. Paracetamol and ibuprofen. These painkillers are great at reducing sore throat pain and also a fever. Now to keep sore throat symptoms to a minimum, I'd advise you to take a dose at regular intervals. This is as directed by your pharmacist or on the medication packaging. Tip 4. Medicated lozenges containing local anesthetics like benzocaine, hexylresorcinol, or anti-inflammatories like flubiprofen have shown some evidence to reduce sore throat pain by a small amount. These can also be taken alongside paracetamol. And as always with all medication, please always speak to your pharmacist and read the information leaflet that comes with it to make sure that it's suitable to take it. There are also other tips that can help manage your sore throat symptoms. So for instance, eating cool or soft foods, avoiding smoking, and sucking on ice lollies, ice cubes, and boiled sweets. I would avoid giving these to young children, however, due to the risk of choking. And last but not least, if you can, rest. And maybe watch Abraham the Pharmacist videos too, because they may make you feel better. On a more serious note, however, there are times that you should see a doctor when you have a sore throat. Now I've left more information about this in the description below, and I'd recommend everyone to read it. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos. La 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 la, la la la. Get my voice ready. Some evidence to reduce sore throat. Vocal cords ready, you know. And if you need further... I've got my Invisalign trays in. It's very difficult to speak. This is the first time I'm filming Abraham the Pharmacist video with it in.